Hi, this is Dr. Karli. So what can you expect as a possible or potential patient here at the Karli Center? Typically, we'll communicate with you remotely, meaning we'll find out a little bit of information about you, about your problem. A lot of times we'll review laboratories or MRIs or X-ray that you may have had done. And sometimes we'll even order those studies directly through you or through your local physician and primary care doctor to screen you before you come in or be seen formally. Then once you get here, there's a pretty comprehensive evaluation that occurs, meeting with myself or our other physicians on staff, as well as our team. And we'll work extremely hard to make your experience here a pleasant one. We'll go through the pros and cons of different options, traditional treatment options, biologic and cell therapy options, and sometimes surgical options, to make a decision as to what we think is best for you. If we decide to move forward, then we'll go over in detail the specifics of your procedure, including the risks and what you can expect, what you might feel. We'll talk about anesthesia if you want to be more sleepy or more awake, depending on the type of procedure. On the day of the procedure, you'll come in. A lot of times we'll put an IV line in you to hydrate you or give you anesthesia. Sometimes we'll do some IV nutritional support right in the IV line before and or during your procedure. A procedure is typically guided, so usually in almost all cases, we'll use ultrasound and or X-ray guidance to precisely target the area that we want to treat. We'll draw blood or some blood from the back of your hip if it's a bone marrow stem cell type of case, or from your abdomen if it's a fat or adipose cell therapy type of case. First, then that tissue is taken over to our laboratory and processed. That takes anywhere from 20 to 30 minutes. We keep you comfortable during that time, and then we come back to the room with the final product and implant it under guidance, as I mentioned. We work extremely hard to keep you comfortable. There's a lot of fear and sometimes misinformation around these procedures. If they're done very well, you are comfortable. I'll tell you, if you're awake enough, what you're going to feel at all times during the procedure so you can relax, not be so anxious. And what we hear from most patients afterwards is, that really wasn't too bad. I was pretty nervous going into the treatment, but it really wasn't bad at all.